Using a 9-point needle to work on the nasolabial fold, first set your machine to 80 jacks per second, but depending upon the depth of the skin, do between 70 to 90. For the nasolabial fold on this particular client, I would use 0.4 millimeters, which you can learn how to do in your depth setting. Then, using your pinky as your anchor, place the pinky finger on the face that holds your stability before starting the treatment. To do one-way striping, you will lay all 9 needles, 5 needles on top of 4, or 4 needles on top of 5, place it into the skin at a 45-degree angle, and move the needles upward toward the nose in a one-way striping method. Up towards the nose area until you see pinpoint bleeding. Once you see pinpoint bleeding, your treatment is actually over, and then you'll move on to the next area you'll be working on. Using 35% Bacto Stop to stop the bleeding and kill any bacteria that could be left on top of the skin before moving on. A different technique for a wider wrinkle, something that is a wide wrinkle that requires a 9-point needle module, you can do a zigzag technique, which actually stimulates the cells on each side of the wrinkle. First, place the needle into the skin while also securing your balance with your pinky finger again as an anchor. Then, in a very precise motion, do a zigzag technique moving upwards toward the nose. Once you see pinpoint bleeding in the area you've worked on, you're finished. Then take your Bacto Stop 35% and hold in the area you've worked on to kill any bacteria and to stop the pinpoint bleeding.